Greetings, class. My name is Lauren Wade, and this is a presentation on the review of transcutaneous electrical nerve stimulation, also known as TENS, and its effect on reducing chronic hyperalgesia induced by muscle inflammation. This is a study that was conducted at the University of Iowa in the graduate program of physical therapy and rehabilitation science. So here we have the abstract for this study. And to give a little bit of background on it, the researchers, they knew two things before going into this study. The first is that sometimes unilateral inflammation caused bilateral chronic hyperalgesia. So basically, sometimes there's inflammation on one side of the body that would cause chronic pain on the opposite side of the body, even though there was no inflammation there. The second thing they knew was that TENS worked on the central mechanisms of the spinal cord and the brainstem. So when it came to treating chronic pain, it didn't need to be placed directly at the area of pain or inflammation in order to help reduce it. So with those two things, the researchers believed that they could treat this bilateral hyperalgesia by working either ipsilaterally or contralaterally with the TENS unit. This study presented by Ainsworth et al. Hypothesizes that TENS will reduce chronic bilateral hyperalgesia produced by unilateral inflammation when applied either ipsilaterally or contralaterally to the site of muscle inflammation. There are two studies that were conducted in 2001 as well as 2003 that provide the framework for this study. So they pretty much kind of provide the basis of which the hypothesis was established. And the researchers believe that since TENS use central mechanisms involving the spinal cord and brain stems, that they didn't necessarily need to place the pads directly on the site of inflammation or pain in order to reduce it. So in order to prove that hypothesis, they ended up putting together an experiment that used an animal model to test out how inflammation and chronic hyperalgesia reacted to TENS. So the researchers used an animal model that used rats to test out their hypothesis. And since they wanted to test the effectiveness of TENS on inflammation, what they did was they took a group of rats, they injected them with Carrageenan, and that was just to induce the inflammation. And they tested before, after injection, as well as after TENS treatment to see what their pain responses was. So since rats can't talk, they had to find a different way of testing pain. So they used a mechanical withdrawal threshold test, which is basically them taking a von Frey filament, pressing into the rat's paw and seeing at what point did the rat pull away. And they mark that pressure as basically their pain tolerance. So the rats were first given that mechanical withdrawal threshold test. After that data was recorded, they were then injected with the Carrageenan into the left gastrocnemius muscle belly, which is the calf muscle. And after that, they waited 2 weeks so that injection could take full action and you could see full inflammatory response. At that point, they're then again given that mechanical withdrawal threshold test. That was marked, and then after that, they began a TENS treatment. So the researchers not only wanted to test if TENS would work, they wanted to know to what frequency you need to set your TENS for it to work. So they split the rats up into 5 different groups. We have our control group, which received no TENS. Then we had a group that received high frequency TENS, which was at 100 hertz, a group that received low frequency TENS at 4 hertz. The researchers were also testing out to see whether it would be better to perform TENS ipsilaterally or contralaterally. So that was also divided into 2 groups. So you had an ipsilateral group that received high frequency TENS and low frequency TENS, and then a contralateral group that received high frequency TENS and low frequency TENS. So once again, Those mechanical withdrawal tests were given at the beginning before injections, 2 weeks after the injections were given, and then another 2 weeks after TENS was applied. So our figures here, they show our control groups versus our contralateral and ipsilateral groups, and just basically kind of where each one of them fall with their mechanical withdrawal threshold test at each point. And so as you can see on just about every graph, um, going from baseline to that 2 week point after the injections, we can see that most of the rats, their threshold dropped significantly. So their ability to withstand pressure dropped. So that lets us know that inflammation actually took place, which shows that we're actually causing pain at that point. And then we see at the end, the 2 weeks post treatment with the TENS unit, we see those thresholds start to return to normal, pretty much coming back to where they started at, or even being greater. So in review of the results, as we saw from our figures, all of our rats pretty much started off around the same baseline when it came to the mechanical withdrawal threshold test. We also saw that there was an onset of inflammation after 2 weeks, and we saw that all the rats reacted differently to the mechanical withdrawal threshold test by showing a lower tolerance for pain. And then we saw that all the rats got better after 2 weeks of TENS treatment, and our control group pretty much stayed at about the same, while all of our TENS treatment groups pretty much returned back to baseline when it came to that withdrawal test. So in conclusion, that would show that using TENS, whether it be contralateral or ipsilateral, whether it be high frequency or low frequency, does seem to help when it comes to treating chronic hyperalgesia. The take-home message from this is we see that the TENS is effective in relieving chronic hyperalgesia when used ipsilateral or contralateral. And what I think that tells us from a clinical standpoint is that yes, the TENS does not have to be administered exactly at the site of inflammation, but it's the reasoning why that's important to us. And that is because the TENS unit is taking advantage of descending tracts in order to reduce pain. So it's able to be used at the opposite side as well as the same side and still get the brain to release and open up those opiate gates to release inhibition, which will stop pain. In the same way that you might use dermatomes, meridians, and place pads in different parts of the body in order to relieve pain in a specific area, you would try the same thing with this. It's not specific or exact, but when you have somebody who has chronic pain on one side, you might try working the other side to try to see if you can get the brain to send down some inhibition in that area.